Hey guys, Dr. Vuckovich here with Victory Chiropractic, and today we have Mark. Mark is a online fitness, health, nutrition coach. Look him up on Instagram, Shulk Fit, if you have any questions about his services and what he does. What are some of the services that you offer?
Nutritional services, diet, obviously diet, nutrition programs, cardio programs, supplement programs, digestive health issues, athletic performance, just a few. But if you go to shulkfit.com, you can see more of the services that I offer, as well as some of the transformations that I've been able to perform.
Yeah. So Mark's a super knowledgeable guy in the fitness industry. So he started coming to me about a month or so ago through social media. He drives about over an hour to come see me a couple times a week. So he's really finding value in what we're doing here. So right now we're gonna go through what we do for treatment for him. So we're dealing with a lot of myofascial issues from some previous injuries that didn't recover properly, and then some structural issues that we'll go through with some adjustments. So we'll go through adjustments today, and then all the therapies that we're doing to help sure he's recovering properly. All right. All right. So Mark, maybe start on your back here. We're gonna stretch you out a little bit. We'll start with just making sure everything's nice and loose on him, stretching out the hamstrings, glutes, make sure there's no tension on that lower back. So we've been working on some imbalances in the hips here, and a little bit of a quad injury that he sustained coming out of a deep pocket of a squat. So this left quad, you'll see us working on later, we're really focusing on lengthening the fascia and making sure we're turning on that muscle-mind connection to make sure it's firing properly when he's engaging it. If you guys have any questions about what we're doing, why we're doing it, make sure you comment below. Shoot us a message, you can contact the office. See if some of these therapies are good for you. So Mark, how long have you been doing the fitness coaching?
I've been fitness coaching for a little over 7 years now, just kind of a natural evolution. I'm also a teacher, elementary school PE teacher.
It's physical education, not gym. My wife is a physical education teacher as well. Gym's a place and a person.
Very good, very good. You've been educated.
You gotta make sure.
Yes, yes. And so it's just something that I'm passionate about, and I enjoy helping people and seeing them transform physically as well as emotionally and mentally as well.
All right, let's have you go face down for me. Again, just doing a nice little stretch on the lower back here, decompressing the back. Mark is a fairly large individual with a lot of muscle mass on him, so he's a little bit more difficult to adjust. There's different techniques that I utilize to make sure we get good movement through everything. And get everything functioning properly. So adjusting this mid back. Take a deep breath for me. Put it out. Drop the arms down. So all this mass up here in his upper traps, it's gonna cause a lot of tightness in the neck there. Good. On your side towards me. Other side. release up. One of the issues we'll be addressing when we do the therapies is there's a lot of tightness in the anterior of his chest and pec. Good. Relax. Which is dominating the whole shoulder complex and pulling the shoulders anterior. So we're doing a lot of myofascial work to loosen up the front between dry needling, Graston, active release. Breath. And cross your arms. Okay. Tuck your chin. Good. Let's do it there. Hands on your stomach. Close your mouth. Don't bite your tongue. Relax. All right, guys, so now we're going to go through some trigger point dry needling through his pec and his quad. So he had some kind of muscle damage between the fibers from an old chest injury that never really resolved itself. So that's the initial reason why Mark came into the office. So we've done a combination of different therapies, and we found that doing a little deeper with trigger point dry needling and then scraping it out has been the best results. Same thing with the quad. So we'll start here. And most time people ask, is dry needling painful? And for the most part, it's not. You can elicit a bit of a muscle spasm for a split second, then kind of goes to an ache. It will trigger a sympathetic response, which will maybe make someone sweat a little bit. So we're starting towards the sternum and kind of just working our way laterally. People ask what this therapy is good for, and it's not just big bodybuilders like Mark here. It's for anyone. A lot of overuse training issues. Great for forearms, biceps. I do it on a lot of moms who are holding babies too much. They get their bicep tightened. There's a little bit of a muscle twitch there. Last one here. Good. All right, we're gonna let those sit for a little bit, and we're gonna come back and focus on the quad here. So now we're gonna put our attention towards the quad here. So Mark, maybe fire your quad. Okay. So he damaged a little bit of an injury coming out of a squat where it feels like his medial head is not firing enough. So what we're gonna do is we're gonna kind of bring the needles deep into the tissue here. Kind of get that to reset. Let these sit for a little bit. And the next thing we're going to do is go through, do some myofascial release. Just two more. Good. Last one. All right, we're gonna let those sit and then we'll come back to them. All right, guys, now the needles are out, what we're gonna go through is do a little instrument-assisted myofascial release, or Graston. So put a little bit of a lubricant there. Pull the arm out. So what we're doing here is create a little bit of micro trauma, more of a superficial depth, unlike the needles that go a little deeper. And just try to loosen up this pec a little bit more. Get a little bit of gradiness, which is way improved from what it was when we first started. As I mentioned before, Mark's been driving over an hour to come see me for these therapies. And so, Mark, why do you feel like it's more beneficial to make the trip?
Well, I think first and foremost, with Dr. Vuckovich kind of being an athlete himself, he knows how important it is for me to get back into training as soon as possible. Just the comprehensive nature of the visits, where we come in, we address what I'm currently experiencing, and then he comes up with the protocol for whether that be adjustments or the dry needling or ultrasound. There's not a one-size-fits-all kind of prescription. It's kind of based on how I'm progressing.
As Mark was saying, though, yeah, when patients come into the office, we assess everything, come up with the best treatment plan for them. Not everyone's getting the same thing, and the treatment's going to change based on your progression. All right, so pec's good through there. Now we're going to focus on the quad here. Alright, so the quad is a lot larger muscle, needs a little bit more tension on it. The biggest thing we're working on is trying to get different layers. So actually I'm going to have them flex here. And slowly relax it. Flex. Relax. See a little bit of that petechia, that redness coming through, really increasing the blood flow to the area, getting a little bit of a pump. And all that's going to do is trigger to the body that needs some healing. Again, this bruising is not the goal. All depends on how the body reacts. Good. All right, the last thing we do now is some electric muscle stimulation. So we're going to be doing this on the quad, as well as the pec. And what this is going to do is just kind of help fatigue out some of those pain receptors. We did create a little bit of micro trauma today. We'll put some ice on top of there to help reduce inflammation. Okay. So again, if you guys have any questions about therapies that went over today, if you're interested in any type of nutritional coaching, contact Mark at shelfit.com if you have any questions. But again, make sure you subscribe and tune in to the next video.
Victory.